Thank you for the introduction. I have nothing to disclose related to this presentation. Few data are available on temporal trends in the procedure and clinical outcomes of bifurcation PCI, which may help us understand the clinical impact of new techniques and devices in this field. We tried to evaluate the 10-year trends of bifurcation PCI and their prognostic effects in large nationwide real-world registries, which is COBIS II and COBIS III, covering the period of year 2004 to 2015. The inclusion criteria of the studies are the same. The coronary bifurcation lesion with the side bench equal to more than 2.3 millimeter in diameter confirmed by correlate PCA, and also all lesions should be treated with the DES. The exclusion criteria of the study is somewhat different. So we excluded 45 patients with LVH fraction less than 30% from COBIS II registry to match the patient selection criteria. The final study population was composed of 5,498 patients. So this is clinical and lesion characteristics according to the three trimesters divided by period. The proportion of diabetes has been increased, and also the proportion of chronic kidney disease has been increased over time. And the multivessel disease proportion was significantly increased also, and left main bifurcation is more widely included in the later trimester. So more complex patients have been treated with PCI over time. When you look at this figure, you can find that the multivessel disease proportion is higher. Diabetes, the proportion is increased over 10 years. And also, the true bifurcation lesion proportion was increased significantly, but the left main bifurcation is less likely to be included in the later period of the registry. So this is suggest that we have the better target lesion selection, avoiding left main true bifurcation lesion, which may be not the excellent target for PCI procedure. This is the procedural characteristics. As you can see here, the proportion of the one-stent technique has been increased significantly over time. And second generation DS is actually has been available since the year 2009 in Korea. So after this period, virtually the second generation DS replaced all the DS used before. Transradial intervention has been grown over time, and the use of IVUS, the application of the proximal optimization technique also has been increased, mostly after second trimester. The procedural success in main vessel has been somewhat increased, but notably the success rate in the side branch has been reduced significantly, mostly because of residual percent diameter stenosis, which has been increased over time. Maybe this is because of the wider application of one-stent strategy rather than two-stent technique, which is related to the higher residual stenosis after the procedure. So as you can see here, after this period, the simple crossover technique is dominant. When the one-stent with a side branch ballooning, two-stent technique has been decreased somewhat. So what about the clinical outcomes at 2 years? The clinical outcomes has been improved dramatically, both device-related adverse event, so-called target vessel failure, and also the patient-related adverse event has been improved dramatically. Notably, after the year 2010, this actually matched the period of full availability of generation DS. Now, second generation DS may be the major cause of the improved outcome. The improved clinical outcome is mostly driven by the target lesion revascularization, which has been reduced dramatically. The rate of cardiac death, MI, or stent thrombosis has not been much improved, and not significant. This is actually virtually the same over a period. The improvement of clinical outcome has been noted in both the two-stent strategy and the one-stent strategy, but more notably, dramatically shown in second stenting strategy. Also, the one-stent technique has a significant improvement, but in two-stent strategy, the outcome, target vessel failure was halved with 50% after introduction of a second generation. What other predictors drive the changes in the prognosis? In the multiple, we tested many predictors and found that the only two variables have a significant interaction p-value: second generation DES and true bifurcation lesion. You can see clearly the second generation DES is a major impact of improved target vessel failure, and also the true bifurcation lesion, the outcome was dramatically improved after introduction of second generation DES. But one-stent technique, actually, the change was not so dramatic, not significant. How about the PCI optimization technique? Actually, we have the wider application of image guidance and path technique and final kissing ballooning. Interestingly, those techniques, imaging guidance, final kissing ballooning, proximal optimization technique, was associated with the better clinical outcome in terms of target vessel failure only in two-stent strategy. In one-stent strategy, those techniques did not improve the clinical outcome. So optimization technique is more important in the procedure, the complex procedures such as two-stent technique strategy. This is a summary and conclusion. In the coronary bifurcation PCI from year 2004 to 2015 in Korea, we have noticed that the more severe patients, more severe lesions were included in this registry. But with the help of a simple wide application of simple strategy and better device such as second generation DES and better optimization technique like IVAS, final kissing ballooning, and the proximal optimization technique, we have achieved better clinical outcomes, particularly in patients with true bifurcation and treated with two-stent strategy. Thank you for your attention.